Effects of Electronic Health Records, Unintended Consequences. The Institute of Medicine cites underuse of information technology as one of the greatest failings of the U.S. healthcare industry. This presentation fully allows for positive effects afforded by new technology, but tempers the prospects by recognizing unintended consequences from current implementation efforts. The outcomes could be improved by conducting better needs assessment before using this prescription, recognizing possible effects and measuring outcomes against baseline and benchmark information. While the majority of literature and studies reports positive outcomes of electronic health records, this presentation will consider unintended negative consequences of information technology use. We have focused on 4 major areas that the Committee on the Quality of Healthcare in America identified that information technology could improve: computer-aided decision support systems, reduction in errors, enhanced patient and clinician communication, and sharing clinical information. Is an electronic health record really a computer-aided decision support system? 75% of physicians admitted ignoring reminder icons, and many never act on the information. Physicians often create or modify order sets, making it progressively difficult to standardize, update, and maintain data over time. Legacy systems make integration with new initiatives difficult to streamline care and to follow most recent evidence-based clinical guidelines. Unintended consequences have generated new types of errors. End-user confusion about system functionality contributes to new forms of errors. For example, when users make data entry selections from drop-down menus, a new class of juxtaposition errors results from making wrong selections. Computerized physician order entry adoption transforms some acute problems into subtle and insidious errors. Our next slide will illustrate just such a case. Pediatric mortality rates unexpectedly jumped in emergent situations due to lost time and poor communication between members of the intervention team. The arrow highlights the increased mortality rates coincident with the implementation of a computerized physician order entry system. Clinicians complain that computers interfere with accomplishing clinical tasks, particularly during the busiest hours such as morning rounds. Also, in the time-sensitive cases, pre-programmed order sets do not eliminate the second physician needed to enter orders, and nurses spending time at the computer terminal are away from the bedside, effectively reducing staffing to patient ratios, which is a known factor associated with increased medical errors. Computerized physician order entry systems require additional time to complete forms, reducing efficiency, and centralizing pharmaceutical activities often adds processing time, delaying administration of medication to patients. Electronic health records have many advantages, but growing evidence points to unintended consequences with significant impact on patient outcomes. Improved effectiveness and efficiency will require multidisciplinary team efforts combined with advanced technology to bring about improved quality outcomes. Future advances using information technology must maintain patient-centered care, be cognizant of electronic health record disadvantages, and continue to test systems for errors.